Hi there, my name's Jake and I'm the Pharmacy Technician Supervisor here at Lock Haven Veterinary Hospital. Today I'm joined by Dr. German and I have just a few questions about dog emergency care. First, Dr. German, what are some common dog emergencies?
So limping and lameness, vomiting and diarrhea, toxin ingestion, or even over medication ingestion, collapse, respiratory distress, things like that.
What are the early symptoms that a dog is in distress?
So things like coughing and hacking, you can notice that they're having a little bit of trouble breathing. You'll notice a little bit of color change to them or just collapse.
How do I know if I should take my dog in for emergency care?
If you consider it a potential emergency, you just need to go in anyways.
What are the signs of shock in a dog?
Shock would be pale mucous membrane. So if you lift their gums up and you see it's nice and pink, that's usually not shock. It's going to be a pale color or really, really bright red. And they're going to be panting and having some respiratory distress.
What should be done in a dog emergency?
You need to take them immediately to the emergency clinic.
Where do I take my dog if an emergency happens after hours?
We usually recommend the Veterinary Emergency Clinic of Central Florida.
Should I call my veterinarian in an emergency situation with my dog?
You most certainly can, but they may not be able to get you in, so you're going to need to go to the emergency clinic at that point.
What's the difference between an urgent pet situation and a true emergency?
So an urgent pet situation would be things like a urinary tract infection or an ear infection that's happening overnight that you can't get into your regular vet for. Whereas an emergency would be they're bleeding profusely, severe vomiting and diarrhea for several days or with blood in it, limping because of the fact that they got hit by a car or dragging their legs. Those are true emergencies.
Thank you, Dr. German.
No problem. Thank you, Jake. And if you do have an emergency, please contact the emergency clinic.